After his wife of 50 years passed, Arthur stopped sleeping. The days blurred, the phone went unanswered. His daughter gently suggested he talk to someone, and Arthur waved it off, certain that therapy was a luxury Medicare would never cover, and money he shouldn't spend. He was wrong on both counts. The care he needed was covered, a yearly screening for exactly what he was going through, at no cost, and visits with a counselor for a modest share. He went months carrying it alone, guarding a wallet that was never actually at risk. So what mental health care does Medicare actually cover? Why do so many older adults still believe it covers none? And what has quietly changed in the last couple of years? Today, in plain English, I'll walk through the help that's already yours. This video covers outpatient mental health coverage. It is not clinical advice, and if you're in crisis, the very first thing to know is that you can call or text 988 any hour for free. Let's start with the good news, because there's a lot of it. Medicare's medical side, Part B, covers a yearly depression screening, and you pay nothing for it as long as your provider accepts assignment. Once a year, in your regular doctor's office, someone can actually check on how you're doing, at no cost. For a whole generation raised to never mention these things, that quiet, routine screening is often the first door, and it costs nothing to walk through. Beyond the screening, Part B covers real, ongoing treatment. Visits to diagnose or treat a mental health condition, talk therapy, medication management are covered. And after you meet the Part B deductible, you pay 20% of the Medicare-approved amount, the same share you'd pay to see any doctor. It is not a separate, lesser benefit. Your mind is treated like the rest of you. And here's what actually changed recently, because it's the part almost nobody has heard. For years, Medicare would only pay a narrow list of providers: psychiatrists, psychologists, clinical social workers. Starting in 2024, that list grew. Marriage and family therapists and licensed mental health counselors can now bill Medicare directly. That may sound like paperwork, but it's not. It's tens of thousands of new therapists a Medicare patient can walk in and see. In a lot of small towns, the only counselor for miles was one of the kinds Medicare wouldn't cover. Now it does. It helps to know what that first visit is actually like, because the picture in people's heads is scarier than the reality. It's a conversation. Someone asks how you've been sleeping, eating, feeling. You talk. And together, you decide whether a few sessions or a small change to a medication might help. Nobody is judged, and nobody is committed to anything. For most people, it's closer to a checkup for the part of you that carries everything else. And the first one is only hard because it's first. There's another quiet expansion worth knowing: telehealth. You can have many of these mental health visits from your own living room, by video. And for behavioral and mental health care, that from-home option has been kept in place. For someone who can't easily drive, or who finds the first appointment easier to make from a familiar chair, that lowers the hardest step of all: starting. And if things are more serious, the coverage doesn't stop at the outpatient door. Medicare's hospital side, Part A, covers inpatient mental health care when it's needed. There's one number worth tucking away there: a lifetime limit of 190 days of care in a dedicated psychiatric hospital. But the everyday care most people need, the screening and the therapy visits, carries no such cap. For the ordinary work of getting through a hard season, the door stays open. So if all of this is covered, why did Arthur, and so many like him, assume none of it was? Follow it kindly, because the reasons run deep. Part of it is a generation's habit. Many older adults were raised in a time when you simply didn't talk about your mental health. You toughed it out. So the thought of asking never fully forms, and the coverage question never even comes up. And part of it is old information. For decades, Medicare's mental health coverage really was thinner and harder to use than its medical coverage, and that memory stuck around long after the rules improved. People are acting on a version of Medicare that no longer exists. And clear up one more myth while we're here. People assume this coverage is only for severe mental illness, that you have to be truly unwell to qualify. You don't. The yearly screening is for everyone, and treatment is covered for the ordinary heavy seasons too: a hard grief, the anxiety after a scary diagnosis, the low stretch that won't lift on its own. You don't have to earn this care by hitting rock bottom. It's built for the getting through, not only the crisis. And the cost of that outdated belief is heavy. Because untreated depression in later life isn't just sadness. It shows up as sleepless nights, as pain, as a slow withdrawal from the people and the meals and the walks that keep a person well. Arthur wasn't only grieving, he was carrying something treatable, and treatable cheaply. And the only thing standing between him and help was a belief about a bill that was never coming. It's worth saying plainly, too. Needing this is not weakness, and it is not rare. A hard loss, a big health scare, a move away from a lifelong home. These shake anyone. The screening exists precisely because so many people go through exactly this and say nothing. Using a benefit you paid for to get through one of the hardest chapters of a life is not indulgence. It's maintenance, the same as tending your heart or your knees. And if you're watching this not for yourself, but for a parent or a spouse, the quiet one who's sunk into their chair and stopped calling friends, the same doors are open to them, and you can help them walk through. A gentle, "Let's just ask about the free screening at your next visit," is often easier for someone to accept than, "You need therapy." You are not overstepping. You may be the one person in their life who knows the help is already covered. Have you, or someone you love, ever held back from asking for this kind of help? Over the money, or just the habit of not asking? Tell me in the comments, as much or as little as you like. Someone reading needs to know they're in good company. And finding the right person is more doable than it feels from the outside. Your regular doctor can point you toward covered providers. Your plan keeps a directory of who's in its network, and a SHIP counselor can help you find someone nearby who takes Medicare and works with what you're going through. You don't have to cold call strangers or navigate it alone. The first appointment is the hard part, and there are people whose whole job is helping you get to it. So here's what to do, and none of it is dramatic. First, at your next regular visit, simply ask for the yearly depression screening. It's free and it opens the door. Second, if you want to talk to someone, ask your doctor for a referral, and know that the list of who Medicare will cover is now wider than it used to be, therapists and counselors included. Third, ask whether you can do the visits by telehealth, from home, if that makes starting easier. And if the moment is heavier than that, if you or someone you love is in crisis, call or text 988 right now. It's free, it's confidential, and it's there every hour of every day. And to sort out exactly what your own plan covers and who's nearby, your state health insurance assistance program, your SHIP counselors, can help for free with nothing to sell. Reach them or Medicare at 1-800-MEDICARE. Because the saddest part of Arthur's months alone is that the help was already paid for. He didn't lack the coverage. He lacked the one piece of information that would have let him use it. If you know it now, don't keep it to yourself. The person who needs it most may never think to ask. And now you have it, for yourself or for the person you're quietly worried about. So tell me below, did you know Medicare covers therapy and a free yearly screening? If this reached someone at the right moment, subscribe. Next, we look at everything Medicare covers for diabetes beyond the insulin, the supplies people are still paying for by mistake. This is general information, not financial advice and not medical advice. And we are not affiliated with Medicare, so always check your own situation and reach out to a professional for care. I'm glad you're here. I'll see you in the next one.